Jonathan. I'll be your nurse for today. Can you get your name and date of birth, please? Okay, that matches my records. I'm here today because you have an NG tube procedure going on. Is that correct? Okay, have you ever had an NG tube inserted? No? Alright, well, NG tubes are for patients that are nothing by mouth. This NG tube specifically is skinnier and more flexible than the other one. The other one's a bit thicker and it's for suctioning and feeding. This is only for feeding. Right, so let's talk about the procedure real quick. So what I'm gonna have you is in a high Fowler's position. I'm gonna have you in a high Fowler's position, and then during the time of the procedure, I'm gonna have you put your chin down. This is just to keep the esophagus open and make it easier. Alright, and then during the procedure, I'm gonna have you lean forward a bit too. But for right now, what I'm going to do is I'm going to measure this. It's gonna start at the nostril, go back here towards the ear, inner ear, down the neck, and then down passing your sternum, an inch passing your sternum. The good thing about this is that these have numbers, so it'll mark me where I'm supposed to stop. Something that I want you to keep in mind is that this is uncomfortable, so you may have a gag reflex and you may even cough. At any point, if I notice that you're in respiratory distress, or if there's resistance, or if you're coughing a lot, I'm gonna stop what I'm doing, pull back a bit, and try again. Sound good? Okay. After that, after I place the NG tube, we're gonna do an X-ray just to make sure that everything's aligned and in place. Okay. So without further ado, let's open this up. Measure this towards the back of your ear. An inch pass. So I would say you're at a 60. Okay, so my mark is 60. Right. Also, once this hits the back of your throat, I'm gonna need you to swallow. This is also gonna make it a lot easier. So try to lubricate this. Good. Lean forward a bit, chin down. Okay. Side. And once it's back to the throat, we need you to swallow, swallow, my mark was 60, so 55 is my warning sign, and then I hit 60 and I stop. Perfect. Now I'm going to secure this so there's no moving or anything. All good. Now let's get that X-ray. Okay. Now the removal part. Okay, so for the removal of the NG tube, I'm going to put you in a semi-Fowler's position. I'm going to put you down a bit or back. Is that comfortable? Okay. I'm going to remove this. So once I start to remove this, I need you to hold your breath. And this is just, like I said, it's going to make it easier for me to remove the NG tube. And if at any point I feel that there's resistance, I'm gonna ask for medical assistance. So, okay, semi-Fowler's position, hold your breath. And 3, 2, 1. 3, 2, 1. And we're good.
Yes. You,
No, I can cut the butt anyways.